Good morning everyone, this is Sai Manasa, second year medical student. Today I am here to explain the physiological and anatomical examinations of the eye and the ear. Now let's start with the eyes. To volunteer me today I have my sister, she's Pujita and she's 17 years old. Now I am going to inspect her eyes. Let's inspect the eye position and alignment of the eye. Now let's inspect the sclera and conjunctiva for the color of the white scleral background. Now check the eyebrows for the fulliness, height distribution and any scaliness on the underlying skin of the eyebrows. Now let's inspect the eyelids. Note the position of the lids in addition to the eyeballs. Also note the width of the peripheral fissures, edema of the lids, color of the eyelids and the lesions on the eyelids. First I am going to record the pupillary response of the focusing on the near object, which is also called the near reaction. In near reaction, when a person shifts the gaze from the far object to the near object, the pupils constrict. Accommodation: an increased convexity of lenses caused by the contraction of the ciliary muscles. An accommodation of the change in shape of the lenses brings the objects into focus. Now let's test the extraocular movements. Now follow my finger as I sweep it to the 6 cardinal directions. Now to the patient's extreme right, to the right upward, down on the right, without passing in middle to the extreme left, to the left upward and down on the left. Now let's perform the static finger wiggle test for the eye. To perform this test, it is actually used to detect the lesions and the anterior and posterior side of the visual pathway. To perform this test, position yourself about an arm length from the patient. Close one eye of yours and the one eye of the patient, that is the opposite eye of the patient. Also now staring at your patient, wiggle your hand and ask the patient to tell at what moment he can find the wiggling of your hand. Now can you close one eye of yours with your left eye? Yes. Now I'll close the one eye of mine. I'll start wiggling my fingers. You just tell me at what point you can see the wiggling of my fingers for the first time. Okay? Now I am starting wiggling my fingers. It's 2 feet apart. Okay. And this side. Okay. Okay. Now let's move to the ear. Let us know the parts of the ear. This is the helix, the antihelix, the lobule, the tragus and the entrance of the ear canal. Now let's inspect the ear. Check the auricle and the surrounding tissue for any deformities, lumps and skin lesions. If ear pain and discharge or inflammation are present, move the auricle up and down and press the tragus and press firmly the mastoid bone behind the ear. Now let's test the auditory acuity by using the whispered auditory test. To perform this test, ask your patient, do they have any problem in hearing or do they have any hearing loss? To perform this test, stand 2 feet behind the patient so that they can't read your lips. Occlude the non-testing ear and rub the tragus so that they can't hear what you are whispering. Now inhale deeply and whisper into the patient's ear. Use a combination of 3 letters or 3 words or set of 3 letters. Now let's test the conductive neurosensory hearing loss. To conduct this test, we need a tuning fork. Since I am not having it, assume this one as a tuning fork. Okay. Now we are going to place the tuning fork on the forehead, from the middle of the forehead of the patient and let's ask the patient whether they can hear the vibrations on both sides of the ear or only on the unilateral side, that is only on the one side. Now let's perform the Rene's test. To perform the Rene's test, place the vibrating tuning fork on the mastoid bone of the patient. And also, soon after the vibration stops, pass the tuning fork to the ear canal. The passage of the vibrations is actually more in the air when it compares to the bone. Today I have performed a few very easy tests for the eye and the ear. Thank you.